We're talking about all things cellulite. Cellulite is a very difficult problem to treat. There's been various things that have come and gone over the years in the market. The most recent being Quo, which is a collagenase that gets injected underneath the skin in the hopes that the cellulite improves. The FDA has taken that off the market. Things like Selfina are still around. But what I found to be the most effective in treating buttock and thigh cellulite is this right here. So something called Aveli. And basically it's a tool that I as a plastic surgeon can use whether during a mommy makeover or even in the office completely awake to treat buttock and thigh cellulite. It works with a concept called subcision, which is something that plastic surgeons have been using for decades. This is just a more elegant way of actually deploying that concept of subcision to cellulite, and it's actually very, very effective. One of the things I want to talk about is when you're considering BBL surgery, make sure that your plastic surgeon looks at the areas of your buttock that have cellulite, because if you fat graft into those areas, it can actually make the cellulite look worse. Of course, you can treat that afterwards, but in my opinion, it's better to treat that at the time of the procedure while you're under general anesthesia anyway. So it's often overlooked, and sometimes if you've ever had a BBL and you wondered why the cellulite was worse, it's probably because you had the cellulite before and it just got worse after the fat transfer to the buttocks. So I love this for that. Cellulites, again, it's a difficult problem, but the concept is that you can actually find the areas of the cellulite on the buttock, target them, you mark them before the procedure, and you go in and you're strategically going in and releasing the bands. If you look at what actually happens during this process, this over here is a blade, and as I deploy the blade, you guys can see that right here, there's a little blade and there's a light. That light tells me right underneath the skin where the cellulite is, and I actually pull back, and that releases the little septate that is causing the actual cellulite. So you know for a fact that that area has been treated and the cellulite is improved. Now, again, setting expectations is very important. You know, it's not going to necessarily make it look like completely smooth and that you've never had cellulite, but this significantly can improve the way that area looks, especially when you have multiple areas of cellulite. Treating multiple little areas can overall create a better, smoother contour to the specific buttock or the outer thigh in this particular case. So in addition, what I've found actually interesting is that when you've got multiple areas of cellulite on the buttock and you're doing shaping of the entire back, which is what you do during BBL, even if you sometimes don't inject the fat, you're not looking for a significant volume increase. Just by treating the buttock, it expands the buttock and actually can improve projection, and it can almost look like you've had a BBL even though no fat was actually injected. Now, it gives the appearance of subtle improvement and subtle volume improvement. Again, some people call it a petite BBL, but the idea is just going in and liposuctioning the entire back, the gluteal areas, the outside saddlebags, and then actually just shaping the buttock and then just releasing multiple areas of buttock cellulite can actually make it look like you've had a BBL. But it's important to understand that, again, once again, that if you have cellulite and you're considering a BBL, this is a great option, and it should be strongly considered at the time of a BBL. So again, if you guys have any more questions about this, please call our office at 281-242-1061, and we can talk to you about it in greater detail. Thanks for tuning in.